Okay. If not, it says I have to unmute them, and I'm just going to own that I have no clue how to do that. I'll get it figured out. Okay, could you go to the next slide, Mike, please? So we sent out questions to everyone. We sent out a lot of documents, and I want to first go through the role and responsibility of the committee, but I want to see if anyone has any lingering questions from last time. We do have a chat room, and there's a way you can also raise your hand, and I will be able to see who's raising their hand. Are there any lingering questions? We sent lots of documents. We sent the current remote plan. We sent you the IDPH, and you will get a new IDPH document from us. They updated it. We received it last night. I didn't want to send it last night and confuse everyone, but I will be sending it to you over the weekend. Did anyone have any questions from the documents that you were sent? Okay, then we'll go to the next slide. So we wanted to establish some group norms for us to operate under. I want to share these with you, but then if you have any suggestions for any additional group norms, please let us know and we will capture those. So we want to be prompt. We want to start on time, end on time. And so we will always have assigned times in the agenda because we know that you have busy lives and we really want to respect your time and use your time wisely as we move forward with this group. If you can, we ask that you attend all meetings that you can. We do realize that emergencies arise. Some people have already told me that they could not come to tonight's meeting because our group is actually about 45 people. But if you can't attend, you know, we're going to record the meetings and you can get those, or you can touch base with any member of the executive cabinet. I like the cat. You can touch base with any member of executive cabinet. We'll try to help you know what you missed. We ask that you participate. Silence could mean agreement, and that's not always what you intend to convey. So if you have questions, please ask. We do ask, though, that everyone in this room speak their truth about what you're feeling, what you believe is in the best interest of our students, and that if we attack the problem, not the person. And so we're going to ask that everyone communicate in a respectful manner. Next slide, please. This is our timeline. When I said the timeline, it's the timeline for the district to present the plan to the board. And so if you were wondering why a lot of our meetings are very close together, that's the reason why. We want to present a plan to the board for final approval on December 3rd. That is the committee of the whole. If many of you aren't aware of what the committee of the whole meeting is, it's more so like a board workshop. That's where the board really gets to dive deep into the items that we're discussing. We do the long presentations, and then we take that information with feedback and come back for a later presentation. I'm going backwards intentionally. On November the 19th, we want to present a draft plan of the Reimagined Education OPRF 2.0. And that's the plan for second semester. Our deadline for the steering committee to have their sections kind of solid so we can present them to you at our meeting on the 29th is October the 27th. So as you can see, we're working on a very, very, very tight schedule. Next slide, please. So you're probably asking about the role of the advisory committee. Your role as the advisory committee, there should be a slide for that, but if not, we'll just keep moving. Your role for the advisory committee is to not tell us to open in person, not tell us to go hybrid, not tell us to stay remote. We have already said to the board that we're bringing forward a hybrid plan. So that part has been decided. We know that there will have to be opportunities for adaptive pause. how we see your role is helping us to address some key areas. What are the appropriate metrics and medical considerations that we as a team need to take into consideration, not just in bringing our students in school, but once we have them there? What are some of those key things that we need to look for? You'll help us address issues of equity, help us address issues of staff trainings for our staff and for our students as it relates to staying healthy. We hope that you'll be able to give us some insight into facilities and how we can make sure that our facilities are able to accommodate our students as we bring them in. And so we hope that you will help us answer the lingering questions some will present to you tonight and provide us input based upon your, I'm going to ask that you mute. Thank you. And we're going to ask that based upon each of your area of expertise, that you help us to identify and address those needs that are out there. Because when we open for second semester, we really want to make sure that we have everything in place as best that we possibly can to ensure that not only our kids get a high quality education, but that the safety needs, health and safety needs are being addressed for all of our staff and for our students and for our families. Any questions on your role? Okay, next slide, please. There we go. We already asked if there were any questions on the remote learning plan, the ISB. We've already done this slide. I think our slides are out of order. Next slide, please. So I'm going to now ask the steering committee members to speak, to kind of give you an update on what they are currently working on now towards the hybrid, those key pieces that they believe that members of the advisory committee can help them with, and then any questions that you may have for us to add to that list. So I'm going to ask teaching and learning if you would give an update. Greg, I'm going to turn it over to you because I'm not sure if you and Shalima are tag teaming with LeVar. I'm not sure.
Well, certainly Shalima and LeVar, I'm sure will have things they want to chime in on. I'm just going to start with 2 quick points before I turn it over. As we take a look at various hybrid models, of course, the most prominent one for us to examine is what our schedule is going to look like. There are a lot of different models out there that we have, our committees have reviewed, discussed and debated and put forth. They've drafted at this point 4 main possibilities, and then there's like subcomponents with those 4 possibilities. And those schedules range all the way from something that is very much akin to our current schedule, right? That is, you know, an A-day, B-day schedule with half of our classes on one day and half on the other. And the other is, and on the far end of that, it's a 1 through 8 bell schedule that is fairly similar to what it looks like. And then variations of moving from one to the other as we move forward and debating pros and cons for that. So for this committee, feedback from you all on that point would certainly be appreciative. And there was one other point I wanted to say that just came to my head as I was talking a second ago, but those schedules really are the primary concern. Oh, and the last thing I want to say before I pass this over is that the capacity that we have available to us in the school for when we have a hybrid is worth considering, and it has implications for the schedule that I'm sure you're going to hear more about. This is the type of information that kind of bisects with a lot of the committees that we're looking at. But when you take a look at the class sizes that we're able to handle while still adhering to our protocols, you're looking at any given one time about a maximum of about 25% of our 3,400 student population in the building at one moment. So that is about 850 students or so. And that number, so you know, is determined by the size of our classrooms and how many students plus the teacher or co-teacher we can have into that space at any given time. And so that gets us right about that 25, maybe a little higher than that for some classes, 25 to 30% of our overall population. So with those two basic ideas in mind right now, we are pushing through, like I said, various schedule scenarios and moving from there. Our teaching and learning team is made up of a variety of subcommittees, equity, special education needs, technology. And so I don't know if any of those other folks want to chime in right now, but I'll turn the floor over to them if they would like to.
Sure, I can jump in if you don't mind.
Please.
Just to share and kind of piggyback off some of the things that Greg was sharing, the special education subcommittee is working closely in partnership with curriculum and instruction to combine a plan, not just a plan that speaks to how do we transition our students into in-person learning or through various pathways, but how do we make sure that we're being very intentional and considering factors that are important for staff as well as students. Our proposed plan that we're working on for the spring semester is also going to be augmented by a special education division transition plan that will also be very specific to how do we transition our diverse learners back into in-person learning. So we're working very much so close in concert with teaching and learning. We are giving a lot of attention in personalized, taking a very personalized approach to doing what's best for students, while also keeping in mind that staff are and parents are collaborative partners that we want to make sure that we're working closely with. So everything from how do we make sure that we're being mindful of school is different, the landscape of how we educate students is different. How do we plan for everything from lunches to breaks or how students come to school are a key part of our planning. So we're really happy about the work that we're doing so far and presenting a plan that's going to be very student-centered.
Right.
Hold on, there's a hand. There's a hand with the question. Dr. Barbetto.
My question is about the numbers. I saw on one of your videos recently that there are many kids with special needs who are in the building already. And I'm wondering how that relates to the 25 to 30% of students that we can have in the building as we get back to school, whether that's in addition to the kids with special needs who are already in the building or whether that's separate.
So that's a great question. We have a small population of students in 2 learning labs that are currently receiving support on site with accessing remote learning. Those learning labs do have a capacity limit based on the size of the classrooms and spaces they're in terms of how many students can safely be educated in those spaces while practicing social distancing and safety precautions for COVID. And that also takes into account the number of adults who are in that classroom too. Right now, there's only each of those labs have the capacity of 8 students in each. And we consider that to be kind of a pathway or a bridge into our spring semester as we're transitioning more students on site. That does take into account the 25%. There was a significant amount of work and time and attention in terms of the criteria of which students will need to transition at what point to get to those learning lab students. So they will be a part of that 25% as we transition into the spring.
So just for clarification, and Greg, if you want to correct me if I'm wrong, when we talk about 25%, that's approximately 800 students that can be in the building at any point in time. And when we talk about 25%, one of the plans, the proposal that's being worked on that will be shared with you when it has a little bit more teeth in it is on any given day. And so our hope is to have all of our students go through our building in some way, form, or fashion in the scope of a week. And that would be on any given day, that 25%. I see Ms. Olson's hand up.
Yes, apologies if I'm jumping ahead, but we're talking about 25% of our entire student body, but I'm assuming there will be some subset that opts to stay fully remote. And I'm assuming that will continue to be an option for families who aren't comfortable coming back.
Yes.
So,
Yeah.
So what our real numbers, so 25% of our full student body is 800, but let's say only 70% of the kids want to come back, right? So if we can have 800, that might be more than 25% of the total student body,
Yes.
given, right, however many want to come back. So I'm curious, and again, apologies if I'm jumping ahead, will there be some type of a definitive survey sent out to families so we can get a grasp of how many students we're really talking about? Because I'm guessing that would maybe impact the plan or
Yes.
the conversation.
So we will be sending out, and you may hear that when you get to the, when Dr. Sanders speaks. But yes, we will be sending out some type of survey to see what parents opt in and opt out. That was done with the students who are currently on site as well.
Yes.
Those parents had the opportunity to opt in or out.
Yeah, and I think I just want to reiterate really quickly on that point too, that the 25 to 30% is a rough, like an average number of what might be able to happen in the school. And that's based off of what we see as possible within classrooms. Some classrooms, because of the number of students who are enrolled in them and the space that they have, you know, it's going to be lower than that. Some are going to be higher. So, and there are all these other factors that go into that, including what you just said a second ago, Misty, about, you know, students who want to be fully remote, families who want their kids to be fully remote as we go into the spring semester. So all those things have to be factored into this before we figure out what that population is and what that rotation might realistically look like.
And you'll hear probably more of that when we get to the operations group.
Perfect. Thanks so much. And I'm assuming to follow on, we'll have like some assessment of how many classrooms are available as well as how many teachers are able to come back as well.
We'll have all of that.
Cool.
So yes, I'm glad you asked those questions. And some of those things are things that this group will help us formulate.
Perfect. Thank you.
I don't know, Dr. Amis, did you want to add something, or Mr. Thame, did you want to add something under teaching and learning?
Yeah, I'll be really brief about equity. So from an equity perspective, we all understand that COVID-19 and remote learning has presented and exacerbated, right, some racial disparities. And with that, we have to be mindful of race and how, you know, our plans to return to school will play out racially. So coming out of the Office of Equity and also the Equity Subcommittee will be use of the racial equity analysis tool. We used the same process when we were building out the remote learning plan for this semester that we're in now. So we'll be taking our racial equity analysis tool and boiling that down so we can have some manageable questions that will specifically keep race on the table as we plan in each one of our subgroups. Once the subgroups will fill out those 3 or 4 questions in that racial equity analysis tool, that then comes back to the equity subcommittee so we can then process that, apply our equity lens to the work and the decisions that are being made and how we came to those decisions. So then we can just provide feedback to each one of those subcommittees for considerations and recommendations in the work going forward. And as far as the committee, it would be wonderful if folks would be able to partner with us in you know, discovering resources that will help us transition back to school in an equitable manner.
Thank you. Ms. Harden, I know you're part of, I'm sorry, Mr. Thame, I see you. Ms. Harden, I know you're part of the equity conversation as well. Did you have anything you wanted to add to what Dr. Ammon said?
Only that it's important to remember that while this falls under the teaching and learning part of the steering committee, it is equity goes through everything we do and every decision we make. So operations, employee safety, communications, all of that is of primary concern to me and to the equity committee as we work on both the plan we made in the summer for remote learning, but any plans that are made as we move forward.
Thank you. Mr. Thame?
Yeah, I'll just briefly go into what the technology department is doing in order to support the initiatives for the ever-changing model. We rapidly restructured our help desk in the way that we were able to respond and support the needs of the curriculum as we moved into remote, and now our restructuring as we're looking at hybrid. We're also working very quickly on what were normally long-term projects and consolidating that into short amounts of time in order to provide the platforms that the various areas of curriculum need in order to be productive in the age that we're now living in. In addition to that, we're also standing up systems for various areas of the school that need to function in different ways in order for them to do their job effectively and safely and keep the students safe as well. So we're rapidly redefining who we are, and we're leveraging all of our connections to the outside world and vendors in order to secure that technology that is needed in order to be effective, especially in this time when there is a serious bottlenecks in a lot of the supply of technology that's available.
Thank you. So what I've heard, I said I would summarize. What I've heard are supports from the advisory committee around scheduling, around really how do we support our students and our staff from a component of bringing them into our building and looking at space allocations. How do we meet the needs of our diverse learners? And how do we do all of that through a lens of equity? And then also ensuring that under the scope, I think, of equity is making sure that we have all the tools and materials to include the technological aspect as we move forward. And then the surveying, the opt-in, opt-out, the timing of that, and then the identification. I think I also heard from Ms. Olson, the identification of staff who will also be able to work in the building so that we have all the staffing considerations in place as well. Did I miss anything? Okay, then we're going to move to operations, where you will hear from Mr. Anderson, Ms. Sador, Ms. Toretta, Mr. Cariosho, Ms. Perkowski, Mr. Waxler, as well as, it just went out of my head. I am so sorry. Mr. Stelzer.
How you doing? So we've been going over, we have our draft plans done. We're fine tuning them. We have the campus safety hybrid plan. We have the B&G hybrid plan of the cleaning process, which also we're walking the building tomorrow to get a better handle on our capacity study, which our architects gave us a preliminary count, but we're going to double check that so we can be 100% sure. So our team will be walking the building tomorrow. We won't make it to every classroom, but we'll have the dynamics of how the calculations should be done to get those numbers for the report. We also have the transportation plan, which we're working on with the procedures, and we have the information and management plan, the employee safety protocol, which we're updating, and also the food service plan. These plans are being worked on. The campus safety is being worked on with Dave. He brings it back to the group, and we're fine tuning that. Dave, do you want to give a brief explanation about the safety plan?
Sure. Good evening, everybody. So in regards to the campus safety plan, we're looking at various ways to bring in students at different doors, setting up one-way hallways. We go into each room and make sure for the seating chart that the 6-foot separation is being handled. We're also in charge of screenings when the nurse is not available. We have thermometers, checks done at the doors. We're looking at portable thermometer checks at different doors. And we also work with the athletic department in making sure that their current students that are in athletics are assisted and monitored with John Stelzer. Thank you.
We have with the buildings and grounds, we're focusing on the disinfecting. We're focusing on all of the cleaning procedures, the washroom cleaning, the times, desk dividers, plexiglass for the administrative assistants, cleaning the hallways, the corridors, making sure that the kitchen serving lines are clean, the athletics, the gyms, the locker rooms, all aspects of cleaning and sanitizing the building, and making sure that we do everything within the CDC guidelines and making sure we get the correct kill times down and have the right products in the building. And like I said earlier, we're working on the capacity study. The transportation we have, is Carolyn on, or are you going to talk about it, Cindy?
Got it. Thank you, Ron. So for transportation, we currently use an outside service, contractual services that we use. And what they did is they gave us guidelines and what they're going to do before the student actually boards the bus, the seating arrangements that are on the bus, and also to what they do between bus runs, how the buses are cleaned, and also to how they are actually cleaned by night. So we have all of that that's put into our plan. We also plan, because we also have our small buses that we have not been using, what the procedures will be when we start to use those too.
We have our information management plan, which Julie, could you give us a run through?
Sure. So I've been working on this committee, just overseeing all of the the health aspects in terms of, you know, what we're going to do when and if we get a positive COVID case on campus. What will our isolation room look like for, you know, students and staff and faculty that we suspect could be positive with COVID. I've been working very, very, very closely with Mike Charlie and his amazing team over at the Oak Park Health Department for guidance and direction, as well as advice on just about everything we do in terms of keeping everybody in the school healthy.
We have Mike P. with food service.
Yes, the USDA has given all school districts in the United States a waiver that we can feed all children breakfast and lunch for free. So we have been doing since last March, one-day pickup. What we're doing at Oak Park that's different than anyone else is doing, at least in Illinois, is the children, our students, can pre-order what they would like to eat. We change the menu weekly. Or if they don't want to order, they can just pick up what we call a pre-assembled bag. So our bag has 7 breakfast, 7 lunch, and they can get a gallon of milk. A couple weeks ago, we started feeding the children that are the students that are coming into the building. So we are feeding the SPED kids and the connectivity students, and those students also pre-order. So their food is ready for them. We social distance, they step up. We have set places for them to sit at the tables, and then everything is disinfected everywhere. So we're ready to go with the hybrid. Thank you.
And one of our new all-stars on the team, John, he's working on the fall return to play plan. John, you there?
Yeah, I'm here. Thanks, Ron. So the athletic department has kind of been in the building since the summer. We've completed a summer camp season and are nearly finished with our fall sports season under our return to play protocols and plan that we worked with the school district, buildings and grounds office, Dave Walksler, and of course with Mike Charlie at the Oak Park Department of Public Health. The fall season, I think, has gone very, very well. We have about 2 weeks left in it, and we're currently beginning to plan our winter season and return to play plan as well. We are awaiting some specific guidance from the IHSA on specific sports that will operate during the winter season. So we're in a little bit of a holding pattern right now.
And everything that we have questions on, we send our questions directly to Mike Charlie. I know you probably get tired of my emails, but we'd rather be safe than sorry. Mike, did you have anything to add? Mike Coriato, our chief consultant.
No, I'm good. Thank you, sir.
So some of what I don't know if that was that everyone before I try to summarize.
Yes.
So what I heard that I believe the advisory committee could help with, I heard Dave speak to bringing students in the building. And so with how do we do that? You know, because right now we have a small subset of students coming in. But when you're talking about 800 kids coming in, we could use insight in how do we section them off? How do we stagger that? How do we get them in a timely manner so that they can make class on time? Because when you talk about 800 kids, and so I know that we're looking at an app. Maybe we can come and share with you that app and get some feedback on it, tied to the reliability of self-verification and certification of students. When we talk about navigating the hallways, we've 800 kids in a building on any given day. There's 800 different schedules. And so we could use some insight, particularly from our strategic planners or project managers and our construction consultant, and even someone from the medical field on how we can do that in a safe manner. We have some ideas of determining which direction kids can walk or which steps they can go up and down, but your insight would be helpful. Another question is, once they're in the classrooms, we've been told the direction from IDPH vacillates from time to time, and from the CDC as to a 6-foot distance, 3-foot distance, 6 feet if you can, the amount of distance between desks, so that people can walk back and forth. So these are some questions that we also believe that you can help us with, as well as we get asked all the time about the air quality in the building, because it is an old building. And as Greg indicated earlier, not all of our classrooms have the same square footage. So some insight into those things as well, I believe would be helpful. Did I kind of capture what I heard? Oh, and then I heard Mike P. talk about lunch. And how right now we have a place in the lunchroom. Had we not gone into COVID and come back in, and because as you know, we have the South cafeteria is gone. And that was our largest cafeteria. And so we had planned to use one of the gyms for lunch. But how do we do that now with COVID and feed kids within social distance? Do we feed them lunch? Do we release them at lunch? So these are some questions we'll be asking as we move forward, that your insight would be helpful to us. I'm trying to think, what else did I miss? Transportation on the buses, what does that look like? And I heard Mr. Anderson speak about plexiglass. We're looking into student desk guards, but then the timing between class periods, we could also use some insight on as to how we clean and disinfect between one class and another. So I just want to plant those seeds that as we start to develop our questions and our focus for our group, that we begin to address. Ms. Dixon-Spivey has her hand raised.
I had a question, Joylyn, and it's as much for me as everybody else. In terms of the transportation piece, that would be for certain special education students, as well as, are we transporting anyone for sporting events?
Right now, I'm gonna let, what we're talking about is special ed. John, I'm gonna defer with you because you know more about the Illinois High School Athletic Association than I do in transporting students.
Yeah, we have been transporting athletes and teams during the fall season. I've worked with Carolyn Gust and Cindy Sador in the business office. We're limiting the number of students and coaches that are allowed on any certain bus. And we have worked with our transportation provider, First Student, so that that their cleaning protocols are adhering to what we think are the correct protocols from CDC and IDPH.
Yes.
Thank you. Did I miss anything else as I was trying to capture what I heard? Okay. Employee safety, I'm going to turn this over to Dr. Sanders and Ms. Horton.
Thank you, Dr. Pruitt-Adams. It has been mentioned here before that the work of all our committees and subcommittees is very closely intertwined. When we first started working on employee safety protocol, it was meant for the remote learning and just having a limited number of employees and students in the building. So we've always said that the employee safety protocol is a living and breathing document, and it will be updated as the conditions change. So we're watching closely what will come out of teaching and learning to exactly what hybrid plan, and we'll be adjusting our safety protocol accordingly. But as Dr. Pruitt-Adams already mentioned, we're looking at an app which is for self-certification and also for contact tracing. So we've already had a demo from one vendor and have another one scheduled on Monday, and expecting to have a decision pretty quickly. So all employees and students would have the ability to self-certify prior to coming to the building. I don't know if it was mentioned from operations, but we currently take temperatures of everybody who's coming into the building. We have kiosks installed, so everybody goes through one of those devices to have their temperature checked. Last but not least, we will be providing additional training to all our employees. We have a new training platform called Safe Schools, and as part of our mandatory trainings, we'll have some courses related to how to properly wear masks, how to properly wash your hands, and also what is very important during these times, how to manage stress and anxiety related to coronavirus. And I don't know, Sheila, would you like to add anything to that?
Only that the need to work with all employee groups at all times is incredibly important, so that we're hearing from different groups and different concerns that they have, as the safety needs for B&G might be different than safety needs for teachers. But even within teaching, or our teaching assistants, our administrative assistants, our people working in the bookstore, all have different context spaces and different workspaces that they're working in. So that living, breathing document is incredibly important, and looking at how that changes as the plan changes is really our primary concern.
So Ms. Horton, you make a good point. That's one of the reasons we have representatives from all of our bargaining groups in this advisory group, because we want to give voice to some of those things that we may need to take into consideration that we haven't thought of. The other thing I want to add to, this goes under student and employee safety, is the district is investigating the saliva screening. I'm saying investigating because we're still looking into that. And this goes back to the question that Ms. Olson asked earlier about opt-in or opt-out. One of the things I think that this group could help us with as we look into saliva screening is, should we go with that? We have some students who, some of our more diverse learners who won't be able to do the saliva screening, and their parents may still opt for them to. How can we assure that we are being equitable in our screening, and that we're trying to maximize the support that we can give to all of our students and our staff as we move along that way. So what I heard from employee safety is training for everyone that will take place on our new platform, giving voice to all of our bargaining units so that we hear what they need and what they believe needs to be in place with regards to our safety and health protocols. Okay, I'm going to move to communications now.
Hi, Karen Sullivan. I'll be really quick. A big part of my job is taking all this work that everyone is doing and putting in different formats and pulling it all together into one cohesive plan. I do a lot of behind the scenes stuff, helping to organize the town hall, helping to organize the advisory committee meetings, the steering committee meetings. I'm working with Dr. Pruitt-Adams on a Monday memo to keep people more, we're hearing that people want to be more informed about the process along the way. So that's a new thing that we're doing. And then once we have the plan, disseminating that, making sure that everyone understands what the plan is, what the metrics are, and that is something that that I'm working with the superintendent on, is determining what key metrics should determine our movement from stage to stage. Right now we're in what we're calling OPRF stage 2, where we have about 80 kids on site for a variety of reasons. What are the metrics that would allow us to move into stage 3 with more of a hybrid approach, where any child, any family who wants their student on site is able to opt into that. So that's something that we definitely need the expertise of our medical folks helping us determine that. Yeah, so it's kind of a summary of what I'm doing.
So what I've heard from Karen is we need support with identifying the metrics as we bring more students on. As you know, our current plan is for first semester. And so as we quickly approach second semester, really wanting to identify what that range of positivity rates and safety are for us. You know, I heard today that Illinois had the highest one-day rate of positive cases ever. And 500 plus deaths. And so as the rates move forward, I think with all the medical professionals on this team, you guys will be really able to help us identify that. So you've heard what we're working on, and as I said, you haven't received those documents yet, but you will as they begin to progress, because we'll constantly want your feedback. So what we will need from this group, you've heard from teaching and learning, operations, employee safety, you've heard about student safety, you've heard about transportation, you've heard a lot of what we're doing. Are there any questions that ping for you, or any topics that ping for you that we may also want to consider as we are working on our hybrid plan? And I'm opening this up for comments from you. I know we gave you a lot, but I'd really like to hear if there was something that you were hoping to hear that you didn't hear, that maybe we haven't recognized yet. I'd like to hear that. And if there's some questions that you have that you think we should add to this, this is the time. I really would like to hear from our students as well.
And Dr. Pruitt-Adams, we have about 9 minutes for this section.
Okay. So Amelia?
Yeah, so I have a couple questions about when students are being invited back into the school. A lot of colleges, they are having kind of like an accountability measures for students who break social distancing outside of school, like going to parties, going to the city, and like, kind of being stupid. Will you guys be trying out things like that, detentions, maybe not expulsion, but just being able to hold students accountable? Because you guys can organize all you want. If 4,000 kids are out doing whatever they want, it's not gonna work.
We've talked about that, but I think that's a good question to add for discussion. How will we hold students accountable? But it's not just about holding students accountable. There's some family accountability as well. Our range of authority stops at a certain point. And so we've talked about PSAs. We meet weekly with Mr. Mike Charlie from the Oak Park Public Health. When we know that there's a spread, we try to send something out. In our Husky mail every week, we talk about social distancing. I started doing a once a month video message where we talk about it. But that's one of the things we do want to address. That's why we have, when we get to the focus groups, you'll see we have a focus group on student and staff training. How do we get to our students that this is important, that if we ever want to come back to life as we knew it pre-COVID, there's a role that they play. The other part I heard from you is, in your question, is the legal aspect. What can we as a district legally do? I heard you use the term suspension. And in our new individual behavior education plan, we're trying to move away from punitive measures to more of an educated measure for handling discipline in the building. And so there are some things that have come up that we will have to check legally. You know, can you suspend a kid for not wearing his or her mask? I doubt it, but I don't know. So that's a good question. I'd really like to see if through Dr. Ammons, maybe some of the students can gather some additional questions from our students. We only have 3 students on this group, but I think that that's critical. Maybe some PSA messages from students would be helpful. Good question. Anyone else with questions or suggestions for things that you think we should take into consideration that we haven't?
This is Linda Francis. I would like us to also consider some of the social and emotional and mental health aspects associated with this situation, and be able to utilize both the work and the committees that exist at the high school, but also the partnerships with the Community Mental Health Board and NAMI and other organizations in the community.
That's another good point. Dr. Rabat, I'm going to get your name right before this is over.
That's okay. Thank you.
I want to address something real quick before I come back to your question. Linda Parker is our Director of Student Support. And she's not on this subcommittee. She's on the steering committee. She's not on the advisory. But that's a critical part of this year, the plan for first semester, but the hybrid especially. And so the hybrid we will present will have an ESL component. They've already started some things, Linda, the deans, to really focus on the social emotional aspect, but you know, you make a good point in how we bring in our partners to help us do that. So thank you. With that, that's a good piece to focus on. Doctor?
Yeah, there were 2 things that I just wanted to make sure that we could investigate. And one thing is the timing of the survey that's going to be sent out to see how many students will come back, because I do think that that piece of information can help guide us. Like, I'm delighted to have some of the infectious disease experts that we have in helping make the decision about distancing, for example, with desks and what's the safe way to do that. But I think the first piece would be having some idea about the students, because if we know that the number is low enough that we can accommodate 6 feet, then we can kind of make that the deal. Whereas if the number seems to be a little more and we could accommodate 3 feet and we know that that's a reasonable decision, that may help kind of guide some of those decisions. So I think timeline wise, it would be helpful to have a sense for numbers. And the other thing that I would like to know is like the legal aspect of the kids being responsible for some of the cleaning and disinfecting that happens either earlier in the day or between classes, and whether that's a feasible option.
Right, that those are 2 good points, because we have discussed maybe students wiping before they leave, but you're absolutely correct, checking into the legal aspect. And then the other thing I heard was getting out the opt-in, opt-out information as soon as possible to assist in scheduling. Okay, Misty Olson. And Karen Sullivan's capturing all of this.
So just to clarify on the survey, because I agree, I think understanding kind of all of the state of all the resources, kids, student building, whatever, will the first communication truly be the opt-in or out, or will we just take a temperature initially to say, you know, given these parameters of a hybrid plan, would you be willing to send your kid back? You know, is it that? Because I know with D200, we got kind of an initial survey to see how people were feeling. But then after the plan was presented, we had the official opt-in or out, because people don't really know until they see the plan and understand it. So I just want to clarify, you know, what comes first.
We hadn't discussed that, so that's a good question for the focus, the focus group that will be doing that. So thank you.
Dr. Prudhomme, you probably have time for one more.
Okay, any other questions?
You know, I just, if I could, just it's not so much a question, but something to keep in the back of the mind. First of all, I appreciate the thoughtfulness that's gone into framing all this up till now, and I hope we can be helpful as we go forward. But one of the challenging things about this, and it may not be for this group, is just determining how we set our expectations for the community. And that includes not only the students and parents, but all the staff, employees, and teachers, so that folks have an expectation of what this looks like, not only in terms of the process, but the outcomes too, because it's reasonable to expect there will be cases among students, among teachers.
Right.
Some may be unassociated with their time at school, some may be. But I think one phenomenon that folks are understanding, it's excellent to bring together all this operational and other expertise, but I think a lot of the decision making ultimately is rooted by, in essence, what's our tolerance of risk, and what's acceptable as a district and as an organization. It's a hard question, but it's one that I'm sure you're keeping in mind behind all the rest of this compiling.
Absolutely. I think what I'm hearing though from you is the communication of that is clear to everyone.
That's right.
Because in one of the documents we sent you is the adaptive pause that so we know, and we've been told all along, it's not a point of if it's going to happen, somebody's going to get COVID, it's when, and then how we respond to that. And so what we got a new document last night that you will get that updates that adaptive pause. And so you're right, I think we have to stress that this is the expectation, this is what will happen should this happen. So thank you for that. That's great. Any other before we move to the next slide? Because we have about 25 minutes left. So we're not doing too bad on time. So
hi, can I ask a question? The other thing to piggyback onto what Dr. Weber said, I totally agree 100% that I think it's very important that there will be cases of COVID, and there are families who are willing to accept that risk, and there are families who are not. And I think that's something that really needs to be asked. The other thing, and I especially have seen this with the younger kids with D97 is, and I don't really know, maybe I missed what the exact hybrid plan, and maybe there isn't a hybrid plan yet that's been put forward, but when D97 came out with their hybrid plan and they basically told the parents the kids are going to be in school for 2-hour chunks, 2 days a week, most of the family thought that was ridiculous to, logistically to get their young children to school for 4 hours a week. And then most of those families are opting out of, being in the building at all. So what does the plan look like for the students? Are they going to come for half a day, 1 day a week to get the quarter of the student body in the building? Because that's almost not worth anybody's time for a lot of families. And it's either going to, bring the numbers of the people that want to opt in way down. And then the other, the risk component, obviously, like if they live with a grandparent or something like that, then those families may opt out completely. So I guess I just wanted to bring that up.
So I'm going to start to respond to that, and then I'm going to ask Mr. Johnson to chime in, but I want to answer one of the questions that came up in chat real quick. And it was, are we looking at and reaching out to other schools? Yes, we are. That we have weekly superintendent meetings, and the different people on the Teaching and Learning Steering Committee have also reached out to their colleagues, the principals associations and so forth. So we are gathering information from our partner districts as well as from our organizational groups. So going back to your question, we are currently looking at different options. And our hope is to land on a schedule option that meets the needs of all of our kids, gets them in some in-person. I'm not going to tell you it's all in-person because it's not. That's what a hybrid is. But the difference between high school and elementary as well is you have to have so many clock hours or seat time per class. And so the schedules that are being developed, there's some where, kids are here all day. There's some where they're here a half a day. But even if they're a half a day, the learning still continues. But we are looking at trying to determine the schedule that is going to best meet the needs of our kids. Greg, did you want to add anything to that, that there are a couple of options being considered right now?
No, I just was going to draw attention back to my earlier comments that, we're developing plans right now that fall within a range of something very akin to our current one that cycles folks through that 25% thing that you mentioned, and also something that's more akin to the 1 through 8 periods each day that again cycles kids through a 25% each day. Just draw attention to that. But exactly how that plays out for kids, whether it's 1 day a week, twice a week, or something along those lines, that's exactly where we are right now. Not totally.
Any other questions? Things for consideration?
Would you guys consider only taking a certain years of students on campus? Like again, going back to colleges, some of them are only having like sophomores and seniors on campus right now, and then they have a 3rd semester with juniors and freshmen. So would you guys do like freshman only or senior only?
It's been suggested, but the plan right now does not do that. But we can take that back to the team. Okay, so if you go to this next slide, Mike. So these are the work groups that we've come up with thus far. As Ms. Horton indicated earlier in the meeting, equity kind of grows across the gamut. It's not just instruction, it's not just health and medical, it's not just transportation, it covers the gamut. And so we're hoping to have a focus group or a work group that really helps us look at how we can almost challenge the other work groups to really focus and look through an equity lens in the decision-making process and the recommendations that come forth. Operations covers the gamut of athletics, of bringing kids in safely, social distancing, ventilation, room spacing, how we navigate the hallways. Medical guidance, we're looking for data that really helps us determine a safe entry point, when we would have to go out for an adaptive pause, because going out for adaptive pause doesn't mean the whole school shutting down all the time. It could mean just a subset of people shut down. Medical services, screenings, contact tracing, there's so much under the medical guidance. What's the appropriate ventilation in the room? How can we social distance kids as we bring them into the building? What does the isolation room really look like? We've identified isolation rooms, but have we narrowed it down to how many kids can be in the isolation room at one time? Student and staff training. I heard Amelia speak to, holding kids accountable. How do we educate them on holding them accountable? Dr. Sanders talked about staff training, but are we missing something? What key pieces do we need to make sure that we have in place that we, for me, lower the level of anxiety for our parents who are contemplating whether or not to send their kids to school? Lowering the level of anxiety for our staff who are contemplating, is it safe for me to come back into the building or not? And then how can we make our students part of this process to ensure that we are as successful as we possibly can be? And then the instruction and technology aspect. We talked about scheduling. We talked about whether or not we can adequately feed kids. We talked about the number of kids we can get into a space at any point in time. So these are the work groups that we've identified. As you can see, there are 5. Are we missing one? I know that we talked about, I'm thinking that we maybe need to have one on communications, the surveys that go out, so that it's not, because our communications department is a 2-person department, and there's a lot. And so maybe this group can help us scaffold the communication that goes out, to make sure that it's clear and concise, and that people are understanding what we're asking for. So I would like to add another work group for communications. One of the stipulations, though, I would ask, because we have a lot of medical professionals on this subcommittee, some of who just could not be with us tonight. So there's more than you saw tonight. That we're going to give you an opportunity to sign up for a work group. And I would ask that the medical professionals not all sign up for medical guidance, that you see where your expertise can be benefited in the equity work group, in the operations work group, in the student and staff work group, and in the instruction and technology work group. That you really look at what you think you can bring to the table as it relates to that. As a superintendent and the chair of this committee, I do have the authority that if it's heavy in the medical guidance, that based upon my knowledge of each of you from the medical profession, I will reach out to you first and then assign you to a group where I really think we could really benefit from your knowledge and expertise. So you've heard what we've identified. I've added communications. Is there another work group that you think we should add? Okay. I'm asking because next week is when you really get into the trenches in your working groups. The next slide, please. Okay. Oh, we're there. So we want to give you a few minutes now to do your survey, and it's just strictly identifying the work group that you want to work with, because our next meeting, great, our next meeting is actually next Tuesday. And so we really want to be able to take those questions we heard today, and Karen is going to show those in a few minutes, and divide those out by work groups as well. So something we heard in teaching and learning may end up in the operations group. Something we heard in student and staff training may end up in the equity group. So we want to do that, and want to, when you come into the meeting next Tuesday, really get you into breakout groups so you can start to focus on those areas in that group. So Mike, if you want to talk about the survey and give them directions on that.
Sure thing. What you could do, I'm going to see if I can get this link, and actually I can send it out in the chat also. But if you, I couldn't help myself. I actually had to make a QR code out of it. So if you want to put your phone over it, you can actually click on this. It's a very short survey. I think it has 3 or 4 questions, mostly asking for your demographic information, your name, and your email, so forth, and then which working group you would like to be on. And there's also an other category, so if there's a work group we have not identified that you think would be good, you can certainly feel free to pick that one. So you want to try to put your phone up here, and I'm going to see if I can grab this link, and I will send it out in the chat. So give me a moment.
Also, while he's doing that, I do want to add under operations, operations would have safety and security. It would be inclusive of just the facilities, safety and security, transportation, and food service.
Okay, so I've sent the link out to the chat, Dr. Prudence.
Okay, take a few minutes. And if you would raise your hand or say something when you finish the survey.
We have 2 responses so far.
Great.
3.
Executive cabinet members, you already know what group you're going to be assigned to. So
Yes,
you can go on and click it So that you know.
I've never done it with the phone, so I had to try it.
You should. I'm asking you to. I don't want you to assume.
Okay.
I'm
Yeah, I
asking.
did. It was a, yeah.
Cabinet member.
Question is facilities operations. The answer is yes. Yes, we made that switch, but I forgot to switch it in the survey. I'll probably do it right now.
Are we done, Mike? Did everybody do theirs?
We have 18. We have 18. I'm not sure how to do the math in terms of, maybe we should just ask if anyone needs more time.
Does anyone need more time?
I do. This is
I
Sharon.
I do too.
Okay.
Mike, it's giving me a bump back every time I click sign in.
Yeah, me too.
Up and saying sign in to continue. It won't allow me to go to continue the survey. I can see the survey behind it, but I keep getting a pop-up that says sign in.
Cheryl, are you logged into your OPRF account? It might.
Yes, I tried on my phone logging into OPRF, and then I went to my computer.
Cheryl, I can work with you offline on that.
Okay, that's
If
fine.
anyone else who can't log in, if you would put it in the chat box, and then
Yeah.
that way we can offer you some assistance. I think it was Ms. Starks Turner, you couldn't log in.
Correct.
Ms. McLeod couldn't log in. Anyone else having difficulty? If you are, please put it in the chat box. I see Maya has joined us. We didn't get a chance to introduce Maya. Maya, would you like to introduce yourself? You're muted.
Hi, sorry. My internet's kind of wacky right now, but I'm Maya Robinson. I'm a senior and I'm vice president of SAFE. So, yes.
Thank you, Maya. To Maya, I will send you, if you haven't received already, all of the information that the committee has already received.
Okay, great. And I'm still filling out the survey, but I'm almost done.
Okay. And Dr. Ammons, if you could send me the names of all of the students so I can make sure that they get the letter with the meeting dates.
Will do.
Thank you.
And you know what? I did forward all that information to them already.
Okay.
But I'll get those names to you regardless.
Yeah, I need to add them so they're in the group when we send out the emails.
Sounds good.
So, everybody about done? If you're not done, just let him know. Yes, we do have a representative from the Student Council. Actually, it's the Student Council President. This question came from, I think, Ms. Olson. She just could not join us tonight. What I can do too is maybe share with the group. I had it up, the individuals that could not join us. We have Maeve McAndrews, who is our Student Council President. She could not join us tonight. Donnie Davis, who is on Buildings and Grounds, he could not join us tonight. We have a Dr. Mano, who could not join us tonight, and he is an ER physician at Rush Hospital. I'm trying to think. I think that was, and we have Shanice Reynolds, who could not join us tonight as well. I think I caught everybody who couldn't join us. Okay, as we wrap up, I just want to let you know what will happen next week, and if there are any lingering questions that you have. When we meet next week, we will give you an opportunity. We will have you in your work group. We'll have the questions sorted for your work group to start to identify. We're going to ask that you identify a person to keep notes, because when you're in a breakout session, we can't record the different breakout sessions. And then we're going to ask you to identify some to report out. The work group that you are in will be the work group that you will remain in. The questions we'll give you are just conversation starters on the work to move forward. But other questions may come up as you are working. It is our hope that not the meeting on Tuesday, and the only reason for not the meeting, thank you, Dave. The only reason for not on the meeting on Tuesday, you won't have a document, is we will actually have a steering committee meeting right before this meeting. But our hope is that at the next meeting, we will be able to give you a rough draft of the hybrid plan and where we are, so that you will have something tangible that you can begin to ask us questions about. Any questions thus far? I think in my letter I also included that after we meet 2 weeks, I think we meet 2 weeks, then we off a week through December. This group will continue through second semester. We will reduce the number of meetings through second semester, but want to keep this group abreast of what's happening and continue to get your input. You serve really also as ambassadors, because you will be a part of this process and know what's going on. And your guidance is truly, truly, truly appreciated. Does anyone have any questions of me before I let you go? If not, I want to thank you again on behalf of our Board of Education, our administration, our staff, but more importantly, our students. Each of you has a voice at this table, including it was intentional that we reached out to our partnering districts, and we will have another individual with us next week from D90. Mr. Davis is on the board at D90, but we're also going to have an administrator from D90. We have representatives from D97. We have student representation, parent representation, community member representation, and administration, and faculty and staff. Because in order for us to be successful moving forward, it's going to take all of us. It's going to take everyone in this group to make sure that we move forward in a way that is safe, that is healthy, and that meets the needs of not just our students, but our community and our staff as a whole. So I want to thank you for your commitment of time in helping us get this done, and roll up your sleeves, because next week you're in the trenches and we get this party started. So thank you. I will see you Tuesday. Take care, everyone. Oh, we have a comment. I guess everyone can see the chat. Thank you, Mr. Davis.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Good night,
Thank
everyone.
you. Have a good
Good
night.
night, everybody.
Karen and Mike, can we stay on for a minute? Oh, I forgot to announce that Mr. Yamashita is the, I will do that next week, to tell them you are a liaison to the steering committee. I forgot. If I forget next week, you remind me.
Not a problem.
Okay, thank you. Good night.
Bye.
I'm back.
Good night, Nancy.
You want to stop recording, please, Joylyn?